You have an upcoming surgery and you are stressed. Let's talk about it. So you've done all the right things. You found a board-certified plastic surgeon, you had your consultation, you feel great about the procedure, but the day is approaching, you're excited about it, but you're also feeling anxious and nervous. You're not alone. You are not alone. Okay. So here are my top 5 strategies for how to deal with the nerves and how to calm your anxiety before your big day. The truth is that most patients do feel nervous. I think that's the number one thing that I hear from my patients after I say good morning or good afternoon. Good morning, I'm nervous. Yes, it's completely normal. It's completely normal. You're not alone in that. And I have having been a doctor for so many years and having been a patient a few times, understand how the nerves can really get to you. But being mentally prepared for the procedure can really change the game. It's not just a bunch of nonsense. It actually improves healing. It leads to a better recovery. It can help you manage your pain. And it can even, if you're gonna be in the hospital for a while, it can even shorten your stay. So being able to have the mental toughness for this will also help you have the real physical capacity to heal very well. So let's start with tip number 1. When I feel afraid of something, it's because I can't name it, right? It's the fear of the unknown. I don't know what's coming. And so part of being able to mentally prepare for this day is to actually just prepare for this day. Get as much information about the procedure as you can. Write down all of your questions. We as doctors do not think that any question, whether small or big, is too silly to answer. And if your doctor does think it's too silly, then get a new doctor. If you're gonna be working or under general anesthesia, ask your anesthesia provider what to expect. How does it feel like to go to sleep? What can I expect? And what does it feel like to wake up? What will I remember? What will I not remember? And make sure to discuss what the plan is for pain management after the procedure with your doctor. Because you should not be in pain before you realize that you need pain medication. That's the worst time to start thinking about it. When you replace those stories of what could be with real stories of what will be, it will help you to calm your anxiety. Because at that point, you stop being just the bystander or the project for someone else. You become an active participant in what's about to happen. Tip number 2, believe in your breathing. And this may sound woo, and as a person who does not believe herself to be woo-woo, saying it does sound very woo-woo. But believe me, it works. When patients are having tough spots during their recovery in clinic, if we're taking out drains or doing something that is not fun at all, I will often say just take nice deep breaths. So I want you to try box breathing. You inhale for 4 seconds, hold it for 4 seconds, and then exhale for 4 seconds. So let's do it together. Oh, that's Wait, let's try that again. I took a little too much with the first second, and then the other, I was like, oh Lord. Remember, I have a lung issue, so okay, we're gonna blame it on the lung issue. Okay, let's try it again. Oh Lord, I can't tell you to do it and I can't do it. Well, just try to breathe. Just breathe, girl. Just breathe. Okay, take deep breaths. I believe in science, but I do believe in this. I really do believe in this. It really does work. Maybe not box breathing, but just kind of some deep breath work will do wonders for you. Do not look at my laughing face and think that I don't mean this. I really actually do. And so yes, deep breathing will be your friend through this process as well. Tip 3. Remember, there's no reward for doing this alone. And in fact, you should not do this alone. This is a process that's meant to be shared almost, right? You're supposed to have people that have your back especially during this time. So identify 1 or 2 people that's going to be the point of contact for everyone. If people want to know how you're doing, they call that person in the first few days. So that way you don't have to stress about making sure others are aware of what's going on with you. And outsource whatever you can. I love a good outsourcing. If you have a dog, figure out somebody else who's going to walk your dog. If you need to get groceries, figure out how DoorDash or Instacart or any one of the delivery people can bring the groceries to your door. And then make sure you have someone who's in the house who can take the food from the groceries to the refrigerator and then to you on the couch or to you in the bed. Again, outsource everything. Make sure that this is a community-wide event. Make sure you have a village, okay, that can help take care of you during this time. You, I am sure, take care of everybody else when they are sick, when they are healthy, no matter what, without complaints. So this is now the time for you to be pampered and taken care of. Okay? Tip 4, set realistic expectations. It is great to be positive, to be super positive, but there is a thing as toxic positivity where you're not grounding your thoughts in reality. And so I encourage you that with your surgeon, you really understand what recovery can look like. Recovery typically is not a straight line. It is a road filled with many peaks and valleys throughout the day and throughout the months. And so it's important for you to understand that, to kind of roll with the punches and go with it. Knowing what is normal or what can happen will help you a lot with the frustrations in the moment of not being able to get back to your normal self quicker. And celebrate the small wins. If it took you a week to stand up straight, that is amazing that you're now straight. If it took you 2 weeks to stand up straight, it's amazing that you're now straight. That's all that matters. If you were able to walk a few steps and not feel dizzy, that's amazing. If you were able to sit in the shower and not feel like you were gonna pass out, love it. Okay? These are the small wins that you should celebrate while you're dealing with what feels like a very negative time. And tip 5, this might be the most woo the thing that I say, but visualize the success. Visualize you after a year when all is said and done, when you were fully healed and you are definitely on the other side. What that looks like, what that feels like, what you're going to be doing during that time. When you visualize the road at the end or the light at the end of the tunnel, it will definitely help you get there because you're encouraged and motivated to get there, to get stronger, mentally, physically, what have you. Do not doubt what the mind can do because what you envision will just end up being what you create, manifest. That's the end of my woo-woo for today. So that's it. Get informed. Believe in your breath, even though it sounded like I was laughing through the whole thing. Lean on your team, be realistic, and visualize your success. You will get through this and you will do so well doing it. Now I would love to hear your thoughts. Have you been through surgery and had some tips that helped you get through it? Drop them below. Drop a comment or a question below. I would love to hear them and reply to them. Like and subscribe also while you're there. And love you lots and bye for now.